Hi, it's Dr. Stephen Greenberg along with Sarah.
Hi everyone.
Here from Greenberg Cosmetic Surgery. Now, we want to talk about different options for facial rejuvenation. Patients get very confused about this. Everyone wants to look younger, and we're going to tell you how to go about that. Now, when we look at the face, we look at different areas that may have lost collagen and may have lost volume over time. These areas, like the laugh lines, the marionette lines, and even the jawline here and the cheekbones, are very nice areas that we can put some filler in.
Yes, so a lot of times before anyone needs surgery, we'll do what's called a liquid facelift. And patients tend to need 5, 6, 7 syringes of filler for their face in all of these areas. So we have every filler imaginable here, and there are different fillers for different areas of the face. So a lot of times we'll use a little bit of a thicker filler like Radiesse or Juvederm Ultra, and we'll put that into the cheeks or the jowl right here, this little indent that we get. We have softer fillers such as Restylane Refine or Define, and we can use that in the folds and the marionette lines here. We can use it in the lips as well to hydrate the lips, not necessarily augment them, but just hydrate them. And these are a lot of our fillers here. We have every filler imaginable. We tend to choose the filler and put it in the right spot for you.
Now, so liquid facelifts or rejuvenating the face with fillers is great, but sometimes it's simply just not enough. Often we'll use therapy to help tone up the skin and to give us some lift. Often we'll use what's called a thread lift, where we put little threads underneath the skin to pull up the face as well. And lastly, there's something called the J-plasma lift. We use a lot of lasers to help lift up the skin as well. The final and best result that we get with a face or rejuvenation is either a mini facelift or a full facelift. And what we do is we make an incision that starts on top of the ear area here and goes around the ear, and these scars tend to fade away very nicely in most patients. Sometimes we'll make a little incision under here. And what that's going to do is rejuvenate both the neck as well as the face as well. Now, we often will add some fat grafts into these areas that are very sunken in. So what we'll do is we'll lift up the face as well as do a little fat grafting. It's all about natural here at Greenberg Cosmetic Surgery. We like that natural look. We want you to be restaurant ready in just 1 week and to your country clubs or whatever you're doing in a short period of time. And if you're working, back to work in a short period of time as well, about a week. In-office procedures done under a very light anesthetic. And Sarah, these procedures don't really hurt all that much.
Yeah, patients tend to think, they come in and think a facelift is extremely painful. They'll be out for a month. They need to take off of work for a long period of time. It's not true anymore. These are easy procedures. Patients tend to heal really nicely, and they're really not in any pain. They come in the next day very surprised at how great they feel.
Quick and simple procedures. We can take years off of your facial appearance. Often we'll combine a facelift with an eyelid lift, take out a little of the puffiness, the extra skin, and really give a nice rejuvenated appearance. Dr. Stephen Greenberg along with Sarah, coming to you from Greenberg Cosmetic Surgery.